Well, let me echo first what JP said. I think we're fairly bullish on healthcare as a group of companies at the Ayala Group. We feel very strongly about investing in health as a sector. We feel very strongly that there are significant gaps still in the sector, especially coming from COVID. No, so there's a lot to be done, but there's certainly a lot of growth. I think it's the third or fourth largest sector in terms of growth in the Philippines. I think JP also highlighted earlier, as incomes rise, as middle income segments income rise, we also see a rise in healthcare spending, especially in that particular socioeconomic demographic. So we're very bullish about it. We see utilization coming back up post-COVID. We see people coming back for elective procedures, for outpatient procedures. And so we feel quite strongly that there is much more room for growth in the Philippines, especially for healthcare. There is a growing trend as well in terms of medical tourism, in terms of senior living that we're also looking at. So there's clearly a lot of opportunity in this space.
Paolo, this is JP. I want to go back to that one statistic I brought up a while ago, and that is some of the challenges facing the healthcare industry with regards to access to affordable healthcare. Again, much of the spending actually happens at the top quintile, or as some would say in Manila, the Class A space. Meanwhile, you're seeing spending actually sorely lagging. Actually, when you look at some of the lower ends of the income strata, that, for lack of a better term. Is there an issue with regards to income inequality that's impacting the ability for Filipinos to access healthcare? And could this have some knock-on effects of the broader economy and the health of what might be one of the youngest, if not the youngest, populations in Southeast Asia?
I think it's a great question. I think the fifth, the fourth, and the third quintiles are addressed by the private sector. I think the second and the first, we work in collaboration with the government to try to address the needs for those particular segments. And I'm privileged to sit as the Private Sector Advisory Council head for healthcare for President Marcos, and delighted to see that there's significant progress in terms of expanding PhilHealth coverage, in terms of expanding benefits that our national insurance schemes cover, in terms of providing more access to different kinds of medicine. So there's a lot of momentum on the government side to address those fourth and fifth segments, JP. I think, moving forward, it really needs collaboration between the private sector and the public sector. We're seeing a lot more public-private partnerships as well coming into play. We as a group would be very interested to participate. But we think that's the way forward. I think private sector and public sector just need to work hand in hand to be able to provide more access across all socioeconomic segments.